Yes, good morning.
What is your question for the doctor?
Yes. My 2-year-old was bitten by dog flea, and all his skin is swollen, and he's itching, so he scratched them and they turn out into like little pops. And now he has two on his butt that gets bite, and they turn out into abscesses, like big bumps, hard bumps. What should I do?
Well, get rid of the dog fleas, of course. If you get rid of the dog or the dog fleas, it's very important. But no, he has a hypersensitivity reaction to insect bites, which can cause impetigo, which is infection, especially when he scratches the area. Situations like that needs treatment. You need to clean off the wounds. You need to try to stop him from itching by giving him antihistamine, and he would need antibiotic ointment as well as antibiotics by mouth to treat, especially if it is on his buttocks and causing abscesses. The pox that occur on the skin is very difficult to get rid of those marks, so it's important to try to prevent them when they do happen.
I can very much sympathize having an allergic reaction to mosquito and flea bites myself. Stick to the creams, keep it clean. That's all I can say. I believe we have Lisa.
Lisa. Good morning, Lisa.
Morning.
Good morning.
What's your question?
I called to find out something. Just before my period, I have a yeast infection, doc. What is it? And I got a cure for it?
Yeah, the discharge that one sees sometimes before the period is usually due to increased moisture in the vagina. It's something called leukorrhea, which is a white, watery discharge. Sometimes it's not always a yeast infection, because then it wouldn't go away just like that after the period. But some people, I hear that complaint very commonly, and when we check, it's not of any consequence. It's just a increased moisture which occurs just before the menstrual cycle. If it is obvious, if it is yeast, then of course you need to be on antifungal either orally or intravaginally. But I wouldn't worry if it's not itching and not causing any problem. It might not be too much of a disease or concern at this time.
Already, we've been dealing with men's health, women's health, and all the bits in between. You are very good at keeping up on your research, Doc, and there's always a new trend. There's always something fancy. And in the fitness world, it's Zumba, and in the health world, it's detoxing and all these fun things. What's new and happening on the health scene that we need to either be wary of or aware of?
Nothing out of the ordinary that's come up recently. I know there was a feature on CNN recently on the last heart attack, featuring President Clinton. And he has lost a lot of weight. He has put himself on a diet. He's now off all meat, except, he said, on Thanksgiving he takes one slice of turkey. And it just emphasizes the importance of, there again, men having medical checks and having regular exercise. And then he said, you know, as president he was getting checks, but he wasn't really getting the detailed checks that he was having. He actually had bad coronary arteries and didn't realize it, and he was about to have a heart attack.
The widowmaker, they call him. The widowmaker.
Yeah, widowmaker, yeah. And he said something that it is a foodborne disease, heart attack.
If you think about it, yes.
Yeah.
But that surprised me, though. As president, you would have thought that every time he sneezed, someone would have whipped out, you know, but I suppose it's an occupation.
But how do you exercise the discipline, though, you know, to cut back on all of these things? I mean, how do you do that?
No, you have to feel guilty. You have to have a sense of guilt when you take that Snickers or any other chocolate bar and realize you have to burn it off. And you look at those labels and see how many calories, oh, that's too much calories to put on. You have to be very disciplined and be consistent. I recently went on a cruise and lost weight. And people say, oh, how can you do that? Just discipline. The gym is there, the fruits are there. You don't have to eat everything you see. And you need to food substitute. If you know you take a lot of something, you need to cut back on the other thing. And vegetables are plentiful on those cruises. But we need to eat more fruits and vegetables and drink lots of water and keep healthy.
We got a call from a lady who has numbness in her thumb, and she wonders what's that all about.
Sounds like
numbness in the thumb by itself might not be too much of a problem. Maybe the hand, maybe it could be a pinched nerve, it could be having a symptom of carpal tunnel syndrome, or she may be diabetic. numbness and tingling in the arms and legs might be one of the symptoms of diabetes. So there's many possible reasons for that, and she really should get it checked up. And if we could actually demonstrate a difference in sensation in the area, then we can pinpoint what may be the cause.
And one of our Facebook fans has been asking about giving green tea to someone under the age of 5.
Yes.
Scratch his head.
Yeah.
You know, what's the convention on teas and those sorts of drinks for children?
Yeah, because I've heard parents say, well, don't give them coffee, give them tea. And my understanding is tea is high in caffeine.
Yeah, that's the problem with giving 2-year-olds tea. Green teas, because teas have as high in caffeine, and as you know, caffeine can cause palpitations, insomnia, irritability of the child, affect the appetite and so on, and could cause even gastrointestinal problems. So I wouldn't really recommend giving green tea to a 2-year-old or a young child. As we told, you know, cocoa tea and Ovaltine tea and Milo tea. But, and not to mention all the brands. Yeah. But yeah, no, it's probably, and you know, there's so many, as I was learning yesterday, there are 115 different types of teas.
That's right.
So it's very difficult to know which one to give the child.